Howdy doody do, people. Welcome back for the IBS Freedom Podcast. I am joined by my very rad co-host, Amy Hollenkamp.
Hey.
And today we're going to be talking about anxiety and gut health. And if I may, I will propose, let's talk about anxiety and panic attacks, because I think that it's kind of a spectrum, right? You can have a wee bit of anxiety, you could have more severe anxiety, and then you could have this manifestation of full-blown acute anxiety or panic attacks. And I think we're talking about a lot of the same kind of stuff when we're talking about the two of these worlds, even though they're different entities. So I will propose that we talk about both, particularly as it relates to bodily health and gut health. So if you would like to start us off, to totally put you on the spot, as I usually do.
Yes.
Care to give us a little bit of a preface, a little bit of a something to just get our mental juices going?
Yeah, well, it's an interesting topic in particular for me personally, but because I would say everyone sort of is usually on the spectrum of like, you know, sometimes people lean more the depressed side of things, sometimes people lean more the anxious side of things, sometimes people lean more like angry. So yeah. I think there could be a spectrum of like where people tend to go. Mm-hmm. Personally, I tend to go more the anxiety side of things. And again, I would say personally, it sort of ebbs and flows. Like, I don't think I have like, I think I have more mild anxiety, but it does come up like from time to time. And it's like it's more episodic where like, okay, usually I'm not an overly anxious person, but there could be moments where I get more anxious about different things. But I find just talking to my clients and within my own experience of running more anxious and having gut issues in my past, that it was easy, like when there was gut stuff going on, for the anxiety to come out more.
Yeah. And
then I think again, like, you know, when there's more anxiety, you have more gut stuff. Like there's all this interconnection between the gut and the anxiety. And I find that a lot of people want to blame like one side or the other. Like a lot of my clients like to just say like, oh, definitely my gut leads to the anxiety. But then other people are like, oh, the anxiety leads to my gut. And I think they're, you know, from my perspective, you almost have to support both.
Yeah.
Like
it's a two-way street, right?
Right.
Like,
it's a two-way street. Like sometimes people are like, well, I need to know what's causing what. And I'm like, well, do we? Like we can support things that are going to help the anxiety. But we also need to support the gut stuff if you're having both things happening at once. And I think again, like it can sometimes become more clear, like which is maybe more causing what, because I've seen both cases. Like I've had some people. One case in particular I worked with, she had no like anxiety her whole life, had food poisoning, and like massive amounts of anxiety that wasn't really explained by anything else. And again, we sort of thought a lot of the gut stuff was creating more of the anxiety. And working on the gut did seem to help. But then again, I think there's a lot of cases where like the anxiety is really driving the gut stuff. But I do think that like the best way you can think about it is like there is this like mind-body type connection. And the more you can do stuff to support both, the better. But, you know, sometimes it becomes more clear as you're supporting both, like what might be driving what. But it's not necessarily super imperative that you have to know what's driving what either. Like you can, I think that just by supporting both, you're going to get benefits, if that makes sense. Like I think sometimes people are so concerned of like, what came first?
Yeah.
And sometimes it's just like too muddled and hard to determine. You're almost better off just kind of supporting both ends of the spectrum.
Yeah, I agree. I think that, again, because they are connected, like
Right.
you're probably unlikely to have anxiety and not be impacting your vagus nerve and your motility. Right? Like and we talked about this with the psychologists that we've spoken with, like when we spoke with Julia King and Dr. Franklin, like it's really hard to tease out the experience of anxiety and the experience of stress and the parasympathetic nervous system and that gut brain axis. So I think we're really talking about it's all very related. It's all kind of balled up together. So yeah, I think that if you're experiencing stress or anxiety or both, you're going to be affecting your gut and your gut brain axis in some way, shape, or form. So if you only treat the gut and you completely ignore your stress, or if you completely ignore your anxiety, then you're probably not going to get quite to where you want to be with your gut. But similarly, I have seen patients where they're very anxious and then we treat their gut and they feel a lot better. They might still have that background kind of like baseline of, like you said, like some people kind of gravitate more one direction or the other. Some people experience both. Like I know when I'm not doing good, like mental health wise, I swing more to depression and apathy.
Yeah.
I don't think I've ever been truly depressed, but like if I do anything, if I'm feeling really dysregulated and dysfunctional, I go into this mode of not doing anything, being extremely hands off, kind of ghosting. And like, I want to like totally keep to myself and totally like isolate. And I think that's a little bit more, and I don't really have a lot of the patterns and the circular thoughts that are described with people when they have anxiety. And I wouldn't say that I'm hypervigilant or like over assessing things. I married somebody who swings much more towards anxiety than I do.
Right.
But yeah, I agree with you. I think that we all have kind of a way that our dysfunction will manifest.
Right.
Right? Like it doesn't mean that you're doomed to have anxiety or depression for your whole life, but I think that we have our tendencies, or we have our coping mechanisms when we're dealing with a lot of stuff, or we're dealing with trauma, or if things get dug up in our bodies. I think that our bodies have kind of the go-to way that we deal with that. So for a lot of people, you know, your anxiety can become a lot better when you work on your gut, but you might just have that little bit of a tendency to go back that direction. And I know like one of my best friends, I don't know if I've told you much about her. She had one of the most wicked, gnarly cases of SIBO when we were in grad school together.
Yeah.
Like just, and I think I might have shared this. She lived 20 minutes away from our school in Whittier. And in that 20-minute drive, she had the drive outlined where she would stop at certain convenience stores, certain 7-Elevens to poo, to have diarrhea. Every morning, without fail. She could not drive 20 minutes without having horrible diarrhea. And she was vomiting quite a lot. Like it was that severe. And she was very anxious. And she was having like, not panic attacks, but she was having big anxiety flares. And it made it very hard to go through school and deal with like test anxiety and that sort of stuff. And she worked her ass off and she got through school. But looking back now, she swears up and down that her primary SIBO trigger was stress and piss poor stress management. But for her, she had seen functional doctors on and off when we were in school. They told her, oh man, you're like hella gluten intolerant. She went gluten-free. That helped maybe a teeny bit, but not a ton. Like she kind of went through the gamut. And then finally she ended up working with somebody who diagnosed her with SIBO and said, wow, this is like numbers wise, you're pretty high. This is a really bad case. And she at the time chose to do antibiotics. So I believe she did rifaximin and metronidazole. And within the span of a week, she said her anxiety came down 90% of the way. Like just really profound shift.
Yeah.
And now what's interesting is because we live in this shit show of a world where we've had this freaking pandemic for coming up on 2 years and it's still not gone. And we're all anxious and freaking out on the inside internally. She's been dealing with more stress, in particular with the COVID pandemic situation. And as her mental health has declined in this whole COVID craziness, she's been saying gradually over the course of last year, she's been like, I think my SIBO's coming back a bit. I think it's coming back. And more recently, she actually started experiencing not only an uptick in anxiety, but full-blown panic attacks. And she went to the ER with a panic attack once. She's come close to going to the ER again for another panic attack a few times. And she's kind of currently going through this right now as we're recording this. And I'm trying to support her the best I can as a friend, but also like I'm her friend. I'm not her provider necessarily. But it's interesting because as her anxiety has gotten worse and worse, she's observed that her gut is getting worse again. But in this case, it's like, all right, which came first, the chicken or the egg? Right. I think it's actually that she's feeling really anxious and very, very stressed. And then that's flaming out her gut. But then the gut is making her mental health that much worse because now she gets to deal with the inflammation and the dysfunction from her gut being in not good shape. So it's a slippery slope.
Yeah, it's a whole vicious cycle. And I think the part about it that frustrates me the most is that I think there tends to be a higher percentage of anxiety-prone people within the IBS space.
Yes.
I think there is a common connection there. A lot of my clients have anxiety of some degree, some more so than others. But a lot of the approaches that are so popular in the IBS and SIBO space are anxiety-inducing and like create more fear and anxiety around the gut symptoms, lead to more hypervigilant-based behaviors. And I know that because I was there. Like, again, I had major food anxieties. I've had, been hypervigilant towards different symptoms. And so, it's something that I think is very frustrating watching it go down and watching like popular protocols and popular strategies that might really hijack mental health in a way that's going to be very unproductive for healing.
Well, yeah. And if you think about it, teaching people that food is the enemy or food is bad and teaching them to be hypervigilant and reading every single label and scrutinizing, even to the degree of like seeing an ingredient on a label and thinking like, oh, could that be a hidden source of whatever. Right. Like it's even, I think the food piece of it definitely promotes a lot of food fear and a lot of anxiety and a lot of hypervigilance. And in a weird way, like in health culture right now, hypervigilance is kind of worshipped. I think a lot of the time of like, you're seen as like the healthy person and the motivated person. And you can develop an Instagram following if you teach people how to scrutinize all the labels and only eat organic and like be really extreme. And it's not that reading labels or eating organic is intrinsically a bad thing. It's all about the behavior. It's how extreme are you being? Again, like I've gone to conferences and I've invited people like, hey, let's all go out to eat. And they're like, well, I won't go out to eat if the restaurant is not 100% organic. And it's like, okay, well, y'all are dysfunctional and I'm going to go eat something delicious and hope for the best. Like I'm not to that level. Can I try to buy organic stuff at home? Sure. Do I try to eat healthy most of the time? Yes. But do I think that any little speck of anything with pesticide is intrinsically evil or any little speck of sugar is intrinsically evil? No. Like, I've got like seltzer water right now, like big whoop. But Um, I think that the food piece of it and just this guerrilla warfare mentality with SIBO especially, and Candida, where it's like, Candida is the enemy, SIBO is the enemy, you've got to get them. Like, I'm just picturing people being like in the trenches in a war, and they're literally,
like, ah!
well, yeah, they're like looking around like, oh God, the bomb could come at any moment. Oh my God, they're out to get me. Like, just a lot of the undertones, a lot of the kind of popular culture around IBS and SIBO either promote anxiety and hypervigilance, or they glorify it, or they teach you that you have to be hypervigilant if you ever want to heal. Oh, you're not low FODMAP enough. You're not hypervigilant enough. You're not doing things aggressively enough. You have to up the ante. You're not doing it good enough. Like, there's a lot of that too.
Right. And two things I'll mention there. Like, one thing, like, as like, I think a lot of people with anxiety are perfectionists as well. Like, and so I know personally, like, the not being enough is like, oh God, I just got to do better, and it's just, that's not the greatest mentality to have when you're going through a health journey. But the second thing I'll mention too is, from a hypervigilance standpoint, like, even the hypervigilance of every potential symptom you're having, I find that there's oftentimes can be an overemphasis on like tracking how you're responding to every little piece of food, or like how are you feeling after that food, or and I think it unfortunately prevents people from expanding their diet and like figuring out what foods work for their bodies and what foods don't, because they're so scared of having any change. And like we've talked about a bunch on like the reintro episode, like change is pretty normal.
The prebiotic episode, I think we touched on it as well.
Right. Like, change is pretty normal when you're trying new foods. And so it can keep you locked in this kind of anxious state if you're hypervigilant of symptoms too, because it prevents you from trying different strategies that would probably be really helpful.
Yeah. Well, yeah, and we talked about with prebiotics, like, if you haven't eaten a particular fruit or vegetable or carbohydrate or fiber in weeks or months or maybe years, it's kind of reasonable to expect that you're going to have a little bit of change, whether it be like a slight uptick in bloating and gas bubbles, a slight change in the quality or consistency or frequency of your bowel movements. Like, I think that that's all in the realm of possibilities of normal. And I was just telling a new patient this yesterday. We're having him reintroduce some FODMAPs, and I coached him through that. Like, hey, FYI, like, you could expect a little bit of change, and that's okay. But if you have a lot of cramping or pain or like more notable bloating or more distinct changes in your stool, come on back and let's talk about it and let's figure it out, or message me and we'll figure it out if we need to proceed or if we need to pull back on the reins. But again, like, I forget what episode it was now, but I think I mentioned at one point, I feel like we as clinicians and healthcare providers and people of the internet, we almost need to be promoting two completely different headspaces. Like, on the one hand, there are the people that we're describing who have a chronic health issue. They're already anxious. They're already burnt out. They're already hypervigilant. They don't need more hypervigilance. They don't need more anxiety and more stressors. So for those people, we need to focus more on easing their anxiety and helping them realize that they don't have to overanalyze every little minute detail about their health. They don't need to worry about every new freckle or whatever it might be. I mean, I'm totally exaggerating, but to make the point.
No, I know what you mean, yeah.
Every additional gas bubble, every slight change in like your tongue or your poop. You don't have to be like a hawk watching for all of these things to that degree.
Well, and I think just to add, you don't have to this is funny because we're recording a podcast, but you don't have to listen to every new piece of information that comes out either.
Except ours!
Every Facebook forum.
Yes.
You know what I mean? Like,
Yeah.
I have clients sometimes where I'm like, oh my God, like they're telling me like 5 new things they're trying because they heard it from this random person and this. It's like,
it's
like,
a hodgepodge.
Right. It becomes this hodgepodge. And to me, again, like whenever I see that, I sort of think it can be rooted in anxiety if you're just trying a bunch of different things and struggling to stay on like a specific path.
Yeah.
It's kind of like on to the next thing.
Well, it's desperation, right? Like, it's that scrambling, like, I just want something to work. I just want some relief, which is understandable. But also, it's not an effective way to give your body what it needs and actually heal your body. So, like, I get how people get there, but also it's not efficient. It's not the way that we should be going about treating this. And, pardon me, again, like I think I shared in the nutritional therapy practitioner course where I got certified, I remember one thing that they taught in that curriculum that I didn't really care for, where they had people sit down and take their pulse and then eat a food and then take their pulse again and eat a different food and take their pulse. And I forget the parameters. I think like if your heart rate goes up more than 15 beats per minute, then that's like a bad reaction to that food and you need to cut that food out. But can you imagine telling somebody with anxiety or somebody who's already hypervigilant, like they're going to be taking their pulse at every damn meal of every day of their life, and then they're going to be eliminating all these foods, which they may not have to do. So, you know, it's like this kind of stuff, and this is coming from healthcare providers and nutritionists who are well-intentioned, but they don't realize how big of a deal it is to stoke the flames of somebody's anxiety. Versus, again, like, I think that the people who are more hypervigilant and anxious probably need a different kind of method of care. But then you do have the people, and this is where, like, I get why this comes about. You have the people out there who are eating standard American diets. They're eating McDonald's on the regular and over-consuming alcohol and smoking cigarettes, and they're sedentary and they're pounding down a whole tray of Bear Claws on the regular, whatever it might be, Pop-Tarts. And like those folks are oftentimes walking around blissfully unaware without an ounce of awareness of their bodies. And like they could have a full-on like allergic reaction or a sensitivity reaction, and they would be oblivious. And it's like, if we can teach those people to tune into their body just a bit more, maybe they would start piecing together like, oh, wait, I ate dairy. And then, you know, for like a whole week, I had sinus congestion. Like, you know, I was in that camp. Or like, oh, I overconsumed sugar and then I got a vaginal yeast infection. Oh, so it's like there are people out there, quite a lot of people out there who need to be taught more hypervigilance, not hypervigilance, but more vigilance, I guess. They need to be more vigilant, like more awareness. On top of it, body awareness, and they need to start tuning into what signals the body is giving them. But I do think for most people with IBS, it's the opposite. And encouraging more anxiety and more hypervigilance is actually going to be detrimental for the vast majority of people with IBS and SIBO.
Right. Well, and I think, again, it's so important to clue in, like, as a provider. And sometimes it's not, like, the person saying, like, I'm very anxious. Sometimes it is. Like, I think a lot of my clients know that they're more anxious. And then others that, like, don't know, but, like, I can totally see it.
Yeah.
So I think as a provider, it's something that I'm always paying close attention to, and it guides how I'm moving about the way I'm giving strategies to the client. Because I will say, you know, I see some people like in the gut health space where it's like they have people tracking their symptoms. And again, like I have, there's a one popular Instagram person, I'm not going to name names, who like is designing, you know, symptom tracking guides. And like, while I think that that could be beneficial in certain cases, for someone that has anxiety and already is hypervigilant, like tracking symptoms can be majorly anxiety producing.
Yeah.
And like it can also lead you more towards like just seeing negative symptoms instead of being able to see that balance of like, okay, like, you know, and I'm not saying you ignore negative symptoms. Like it's okay to acknowledge that you're having some negative symptoms, but when that's all you're searching for, it can get you into trouble from an anxiety standpoint. So I think again, like, you know, and there are times too where I'll have people like pay attention to one specific thing that we're trying to like get a read on, but it's not just like have a symptom journal and write down every symptom that you have and like what's going on during that time. I struggle a little bit with that, especially with people that are having anxiety. Like to me, that's like one of the worst things that's gonna create some more anxiety. So yeah, I mean, I just think I'm using it as an example to, you know, you should want your provider to kind of match some of the strategies with the level of anxiety that you're having, like taking that into account and discussing it with your provider, I think can be really important too. Like if you know that you're kind of, whether it's even just the trauma of having SIBO or having chronic health issues are making you more anxious, like I think the more open you are with your providers, the better, because, you know, if something is leading to more anxiety or creating, again, just driving more anxiety.
Yeah, like medically induced PTSD almost.
Right. Like, it's really important to discuss it with your provider. And again, if your provider is good, hopefully that they adjust, they start adjusting strategies to try to help. That would be kind of my thought process on, like, some of the symptom tracking type methods.
Well, and I might have shared this story before. I had a patient that I was working with, and she had IBS-D. I don't remember now exact diagnoses or exact results, but we got her to a point. I know she had elevated hydrogen sulfide producers in stool testing. I remember that much. And we got her to a point reasonably quickly where she was no longer having diarrhea. Like, I think within like a month of working together, she stopped having diarrhea, maybe 2 months, I forget. But she had IBS for about a year, I think. And she had this app where you record the number of bowel movements and the Bristol stool scale number for the bowel movements every day. And she had easily 6 months of historical data on that stool testing app. And I remember the first appointment that we had where she told me that she had been diarrhea-free and having like 1 or 2 nice, well-formed, you know, type 4 poops per day. And we celebrated. We're like, that's amazing. That's great. And she was diversifying her diet. And she showed me on the app, or she sent me screen caps of the app, whatever it was. And I was like, okay, great. That's great. And I think I told her at the time, I said, all right, well, I guess you don't really need to track it anymore. And she's like, well, I'm going to track it a little bit longer. So then we met again. I forget if it was 2 weeks or 4 weeks later, whatever it was. We followed up again. And we checked in, and she said, yeah, I've been great. I have not had diarrhea in a month and a half now. I was like, that's fantastic. And she said, see, here's the app. And she showed me the printout or whatever again. I was like, cool. Okay, but you're done tracking now, right?
Right.
Well, I think I'm going to track it. So she got to a point. I think the last time I checked in with her, she was still tracking. And she's been symptom-free for almost a year. And I brought this up a couple of times at various points. I was like, hey, this is kind of verging on like hypervigilance, maybe a neuroses. Is it giving you any benefit to track now at this point? And I think the way I proposed it, I said, at what point will you believe that you're really healed? Or at what point will you believe that IBS is now a thing of the past for you? Like, do you not trust it? Do you not trust your body? Do you not trust the results that you've seen? Like, what is it about this? And last I checked in with her, she basically said, no, like, I really think it's gone. I really trust it. I trust you. But I think she got to a point where she was like, I kind of want to hit that milestone, that 1 year milestone now. And then I'll be done with the tracking. Right. And I think that was a month or two ago, I think. So I haven't checked in with her since then, but I really hope she stopped tracking her poo. Like, a normal person who does not have IBS does not need to be journaling their poo every day of their life. Like, that's not... There's more to life than journaling about poo quality.
And I do think, too, at times, like, you could have a little bit of diarrhea. Like, let's say you just, like, had, like, a crazy fun weekend or something. You drank a little bit too much than normal, or, like, you ate some different food and it just didn't sit right.
Or, like, this weekend, I got exposed to, I think, dairy at a restaurant. Yeah. And I shared before the call, I had a dream that I was at the Try Guys recording studio, and I went in and I demolished their bathroom, and I was like, oh God, oh God, they're going to know that I'm pooping in their bathroom. Oh no, Eugene and Ned and Keith and Zach are going to judge me now. And then I woke up and my gut was like, ah, and I had a very not good poop experience. Yeah. And my body was clearly purging something out of its system after that. But, like, I know that my body still doesn't do well with gluten or dairy. So it was one of the two of those. Like, I didn't think, oh God, I'm going back into IBS or I'm going back into SIBO. It's just like, oh, well.
Right. Exactly. And I think that's such a good point. And again, like, I have periods of time where, I did something dietarily or like, some random episode of diarrhea or something like that. It just happens. Like, even for people that have healthy guts, like something just doesn't sit right. It doesn't happen all the time. It's not this chronic issue. But I do think that sometimes what I find working with people is I'll get emails or something like, oh, I was doing so well. Like, I had so many, like, I had string. Yeah, I had a month of, like, solid, because it would be like if you're the lady who you're talking about, like, hit the month mark, and then the day after the month mark, they're like, oh my God, like, it wasn't perfect. Mm-hmm. That means I have SIBO again, or, like, I have IBS. So, like, my IBS is back, I need to do stuff. So, like, what I find a lot of times is, like, there'll be progress, and then they'll hit like a little bit of a roadblock or like a hiccup, like their gut's still adjusting. It's not overly resilient. So like the way that I talk about it is if you're in a gut journey, like there's going to be some ups and downs and ebbs and flows. Like you're trying different strategies. Like to me, it's, we want to pay attention to like if your gut's trending in a better or worse direction. But like some of these one-off data points, I think, again, like, if you're hypervigilant, can pull you back, and you're more on the anxious side, can pull you back into this mentality of, oh my gosh, I have IBS, my SIBO's back, I need to do something. Like, it becomes very scary and traumatic just because of past experiences. Like, it kind of pulls you back into that trauma. If you were doing well for a month and had an episode of diarrhea, it feels very much like, oh my gosh, I'm, like, back to where I was or whatever.
Yeah. Well, I was sharing a little bit before this call, a patient of mine that, I didn't tell you this part of it, but he even said that his constipation has been a lot better for about a month, I think. He's been doing pretty well, not constipated really at all. But then he introduced, I think it was tomatoes, that I forget why he wasn't eating them, but he introduced tomatoes. And he noticed that his stool was a little bit darker. And he kind of panicked and he was like, yeah, so my stool was darker. And I think that means that I'm going to go back into constipation and maybe I need to do more antimicrobials. What do you think? And I was like, whoa, slow the train. No, not necessarily. I think that's probably okay. Like, your body hasn't seen tomatoes in a while.
Right.
So, I don't know. Cut it some slack, man.
Right. Well, and I think that it's so important because in that scenario too, you have to try different things. And that could be like not just food related, it could be other strategies too, but you kind of have to push yourself out of a comfort zone to have growth in any aspect of life.
Yeah,
and
that's true.
And I do think like on a gut journey, it's that way too. Like you almost have to push yourself out of comfort zones from a diet standpoint, maybe from a lifestyle standpoint too, in order to grow and to progress. And, you know, whenever you're pushing yourself out of a comfort zone, there can be some growing pains with that. And some, like, you know, maybe you learn that this food doesn't work well with you, but now you know, and you can continue to hone. But I think that there has to be a level of, or some strategies to manage any anxieties you have as you're working on building outside of your comfort zone.
Yeah.
Because the worst thing I think that can happen is that the anxieties sort of keep you stuck in something that isn't working. Instead of being able to expand and try different foods, try different strategies, lifestyle-wise, that sort of thing. Yeah,
I agree. It could definitely be the case that anxiety can hold you back from the things that will ultimately be healing for you. Right. And to that point, you know, this is a good segue. What are some of your favorite tools for people who have anxiety or things that have been helpful for you? I think some of the basics are going to be things like exercise or just movement in general, meditation or any sort of mindfulness technique or a breathwork technique, making sure that you're adequately resting and that you give yourself enough time to really get a good night's sleep every night, human connection, being out in nature. Those would be some of my go-tos. I'll kick it to you and see if you have other ideas too. And then I actually want to, eventually we'll talk about some supplements and some herbs that can be helpful as well. But I'm curious, what else would you add to that as far as like a tool belt for people?
Yeah, no, I think that those were all the main basics. I would say sometimes if there's food-related anxiety, if that's the case, a lot of times I'll try to change some of the thoughts and beliefs. Like, we'll work on, like, specific thoughts and beliefs. Like, you know, what is the fear or anxiety and how can we maybe reframe it? And I know I've talked about this in past, I think maybe even food reintro or something in that realm. I think I talked about this.
After 50 episodes, they blend together.
Right,
to some
they
degree.
do. They all blend together. But I think the more that you can reframe some of your beliefs that aren't serving you, like even just building awareness around like, okay, I have anxiety around this particular thing. Is this belief that I'm having serving me well? And like, how can I reframe this to where it is serving me in some way? So I think doing some like getting some coaching around that, or again, doing some work about building awareness around your thoughts and beliefs around foods can be really important. I will say too, sometimes I'll do a lot of visualization type work with people, like trying to help them visualize, give their brain a dress rehearsal when it comes to trying new foods. So we'll do stuff like that. And again, like usually we'll just take reintros slow at first to help them build confidence. And those would be the biggest things, I think, from the food anxiety side of things. I think you hit on a lot of the great, you know, from an anxiety standpoint. And the one thing that you didn't mention that I think, you know, at some point, if the anxiety is creating enough dysfunction to go seek like one-on-one counseling or therapy, which I know we're both big advocates of. So I think, again, it's probably what you were saying, definitely doing like the basics and maybe trying some food strategies first. But if you feel like you've tried that, or like that's not necessarily making a big dent in the anxiety, seeking out help can also be really valuable.
Yeah. And I kind of realized that after I concluded my statement, that I realized, oh, therapy. Like, that's a pretty huge thing. So, yeah,
Well,
I think
that's why I'm here.
that's right. The yin to my yang, my
Yes.
dear. And speaking of which, too, acupuncture can also be helpful
Yeah.
for anxiety. Or
Yeah.
just, as cliche as it sounds, self-care. So, for
Yeah.
example, like I think early this year, like January or February, I started getting a massage like once every 3 or 4 weeks.
Yeah.
And that's my time to check out and just like kind of ignore the world around me and just like be in the moment and enjoy that massage. So that's been really helpful. Um, I've shared my painting hobby that started after COVID because I realized I needed some stress relief and some
Yeah.
hobbies in my life again. Yeah, I think anything that gets the oxytocin flowing and you feel like really excited about or passionate about or something that brings you a great deal of joy could be helpful for anxiety.
Right.
And even, there's a lot of neat research too. Like I became aware of a breathing technique called Sky. Did I tell you about this recently?
You did. I'm not sure if it was like off air or on air
I feel like it
or
might have been off air. I'm not sure though.
Okay.
But basically, I went to a conference about a month ago. And my favorite lecture from the conference, this guy was talking about a breathing technique that's inspired from yoga or derived from yoga. And it actually has a lot of good human clinical data. And one of the things that it's been shown to help with is lowering anxiety. I forget the stats, but it's been consistently shown to reduce anxiety. So that technique is called Sky, SKY. If you just Google Sky breathing technique, you should be able to pull it up. It's an acronym, but I forget what SKY stands for. It's some sort of Sanskrit or Indian name. So I forget exactly what it stands for, but that has good research. I recently got a new toy and I'm pretty excited about it. Hold on. What is, I forget what the name of like the umbrella term is. Have you heard of the Alpha Stim at all, Amy?
Sounds really familiar.
So it's, oh God, what is it called? I forget. So there's an umbrella term for these types of devices and what they do. I forget whatever the umbrella term is. Cranial electrotherapy stimulation. So
Oh, cool.
CES. It's not the only device of its kind, but it is pretty well researched, particularly with veterans. They're doing some research. But this sort of thing has been helpful for anxiety, depression, insomnia, even pain. A colleague of mine who practices in California and does functional medicine has had a device for a number of years and swears up and down by it and thinks it's the greatest thing ever. And then actually the teenager that I mentioned who was diagnosed with C. diff after he was on doxycycline for acne for like 3 years or 2 years. One of the things that was most helpful for him was his acupuncturist recommended getting a Alpha Stim device, and the patient and his mom swore up and down that that was the most helpful thing for him, which is interesting because you think of C. diff and you think, oh, it must be a matter of diversity and dysbiosis, but ultimately working on the anxiety piece of it with the Alpha Stim was the most helpful thing for him in his journey. So
Cool.
yeah, I just got one. I think they run like $700 or $800, something like that. So they're moderately expensive, but not out of the reach for people necessarily. But
like
that
if it made a big dent in someone's anxiety.
Yeah, it could be worth it.
Right.
But yeah, I recently got one. Same conference actually. They had a booth, and I ordered mine finally. I've been meaning to get one for a while, and I just forgot about it. But yeah, so I'm going to play around with that a little bit because I'm curious if it's going to change any of my Aura Ring data a bit. So between that and learning, I signed up for a class to learn that Sky breathing technique, both for myself and so I can teach people how to do it.
Yeah, cool.
So yeah, I've got a couple of irons in the fire, so to speak.
Yeah, it's so interesting too. There's there's a guy, what is his name now? I cannot think.
Bob.
He wrote a book, Bob, basically. It's called, I think his first name's Patrick, I believe. And he
Patrick
is
Swayze.
Patrick McKeown. I have the book in my office. Patrick McKeown. He's Irish.
Clearly.
But he wrote a book called The Oxygen Advantage. I don't know if you've ever heard of that book.
No.
It's really interesting. I mean, his big theory essentially is that we all are overbreathing. Well, when you're anxious, you hyperventilate, so you overbreathe.
Yep. Okay.
But if you're in a very relaxed state, like if you're in a meditative state, usually you're like barely breathing.
Mm-hmm.
So he talks a lot about how you could potentially lower anxiety by sort of trying to work the breath down. Like sometimes the worst thing for anxiety is someone take big deep breaths. Like that's his theory is like, okay, you don't really want someone who's like having a panic attack to take huge deep breaths. Like you might actually want them to try to like slow their breath. He has some really interesting videos. I can send you some. Yeah. I'd be curious. But he likes to try to like stimulate parasympathetic type. Like he'll say if you're breathing properly, blood flow will be better. Saliva production will increase. Yeah. So he kind of like does methods that sort of help to activate the parasympathetic. Yeah. But it's kind of in the rate of breathing that what he talks about a lot. Again, I'd have to dig through it a little bit more, but he's really an interesting breathwork guy. But I'm curious to hear about Sky too.
It's interesting. I can send you the info. It's the particular class that I registered for. It's like a Friday, Saturday, Sunday. It's like 3 hours each day. So it's not a terribly big time commitment. Yeah. And it's actually geared, the one that I signed up for is geared for like providers and healthcare people. We could be classmates if you want to do it with me. But what was interesting, it's funny you say that because the guy who taught this class and talked all about the research with Sky, he's a psychiatrist. So he's an MD psychiatrist. And he was saying like he initially learned it for himself and then he's been teaching it to his patients. And he was just telling some of the stories about how when he recommends it to his patients, how much it's helped. But he did a session after the fact. Like, after the conference had concluded for the day, he did, like, a breath work session that was optional. And I almost didn't go. I was like, I'm so comfortable in my jammies, in my hotel room. I was watching my beloved Abroad in Japan channel on YouTube on the big TV in the hotel room. I was like, I don't want to go. But I was like, no, I really liked his lecture, and he was a really good guy. I'm going to go. And it was so great. But one of the things he mentioned when he was doing the demo and the tutorial and he was teaching us, he said when he gets like really into this like deep meditative state and he's doing this breath technique, he could get his respiratory rate down to like 2 or 3 breaths per minute. Yeah. So it's very interesting you say that because he did note that that is entirely possible for him to do as he's like developed his practice and honed in on this technique for years now.
Right. Yeah. It's super interesting. I'll send you some of Patrick McKeown. I never know how to pronounce, but he does some really crazy stuff with like athletes where he'll have them like breath hold and sprint. Like kind of weird stuff. But he basically tries to almost put you in a state that's like what altitude type training. Like where you're kind of like there's less oxygen, put you in more of like an oxygen deprivation state. Yeah, deprivation. And he has some theories. I'd have to like go back into it to really deep dive. But his whole thing is that if you're over breathing, your cells actually can't use the oxygen as efficiently. So I don't know if that's true or not, but he talks about a lot of like the CO2 and the oxygen and how they're being utilized depending on how much you're breathing.
Interesting. Yeah, I'll have to check that out. I'm curious. But anyway, I think, to go back to anxiety tips and tricks, I think breath work, definitely, meditation definitely can be helpful. The friend of mine who recently has begun having panic attacks and has been very anxious lately, this, I tell you this with a grain of salt, dear listeners. This might be bordering on a little bit iffy for some of you to do at home. So be smart about it, and maybe only do this when there's somebody around you, and be a little gentle when you first start out. But this friend of mine, again, we went to grad school together, so she's a chiropractor, and she had the idea when she was right on the verge of, again, needing to go to the ER potentially for a panic attack. She thought to do a bit of a carotid massage. So the carotid artery in your neck, where we all take our pulse when we're exercising, that artery has baroreceptors, and they are pressure sensors. And that helps you regulate your blood pressure. So you can actually tap into that parasympathetic nervous system directly from your neck. And she massaged her carotid artery a bit. And she said it actually did bring her heart rate down a good chunk of the way. And she was able to get ahead of a full-blown panic attack doing that, which I thought was a very interesting thing to do. Again, I don't know if that's like a long-term strategy. That I would say is definitely like a Band-Aid when you're on the verge of a full-blown panic attack, but it did help her. What's been interesting, and I've been learning from her a little bit more lately, because again, she's kind of in the throes of this right now. I forget where she found this information. I think because she keeps up with some functional medicine stuff, so she knows like Mark Hyman's podcast and whatnot. I think it might have been one of his episodes. But she came across this info about blood sugar dysregulation, specifically triggering panic attacks and anxiety for people. And she started paying attention to her blood sugar quite a bit more. And actually, at my insistence, she just got a CGM yesterday and started wearing it. And she's been sending me Marco Polos all day, kind of freaking out, because she's like, oh my God, oh my God, oh my God. This is it. And she talked to this naturopath. She wrote a book. I don't know. I'll have to get the information and flesh this out more. I don't know the name of the lady. I don't know the name of the book.
Right.
But basically the whole premise is that a lot of anxiety and a lot of panic attacks are caused by blood sugar dysregulation.
Yeah.
A lot of which is hypoglycemia, low blood sugar, or blood sugar that comes down too quickly. So she was giving me some data points. Like this morning, I think she said that immediately after eating, her blood sugar was at like 119. And then half an hour later, it had dropped 30 points already. She was like, that's kind of fast, isn't it? And if you looked at her numbers, like 119, that's pretty normal. And then it went down to like 89 or 88. Like, that's normal. So I think that some people might even catch their blood sugar on like a fasting blood draw or a finger prick and think, oh, my numbers are okay. I don't have a blood sugar problem.
Right.
But it's like that, it's the slope of the curve that apparently can play a role in this. And she said, one of the things that naturopath talked about in the podcast or wherever she found her was that if you're feeling a panic attack come on, you could take just like a couple sips of juice or a little teeny bit of honey, and then eat like some protein and complex carbs and fat to restabilize your blood sugar. But she's been playing with it the last couple days since she discovered this lady's information. Yeah. And my friend actually said she has staved off a couple of near miss panic attacks by just taking like a couple sips of apple juice and then eating like a more fleshed out meal after that. So kind of interesting stuff. So she's really exploring the hypoglycemia thing now too.
Yeah, well, I'm sure, like, too, like, if your blood sugar's doing wonky things, it's gonna affect nervous system. And that's a really interesting link. Yeah. I have a client, too, in mind that could be extra relevant for. Yeah. But yeah, I think the more your body feels regulated, even from a blood sugar standpoint, probably the better all systems are going to function. But cool. Yeah. Yeah, so I think stabilizing blood sugar and trying to have well-rounded meals. And she confessed, too, I did not know this about this friend. She said, yeah, I've been bad about, like, skipping meals and eating really sporadically. And she's like, I think I trashed my metabolism. And also, she already had underlying tendencies towards anxiety, tendencies of, some PTSD from her really bad SIBO years ago.
And yeah, I think it was just like the perfect little storm of like the pandemic, and they had some deaths in the family, and they had, some stressors and some drama, and just life kind of hitting the fan, so to speak. And then just enough dysbiosis and gut stuff that now, again, her IBS is getting worse again, and she thinks the SIBO might be coming back again. And she's having these full-blown panic attacks, and her anxiety is going up. And so, yeah, I'm trying to help her to the degree I can as a friend, and not being directly involved. But I'm really excited she got a CGM, because I think that that's going to be a really helpful tool for her.
Yeah, for sure.
Yeah.
For sure.
But as far as supplements go, I think that'll kind of round out the conversation probably about anxiety and panic. And I will say this too. Another one, I'll throw out one more story really quickly. I still remember there was this lady who came to work with me, and she found me because she Googled histamine intolerance, and she was looking for providers who could help with histamine. And she came in and she was 110% convinced she was histamine intolerant, and that's why she sought me out. Amongst the crazy things in her history, she was diagnosed as having chronic Lyme disease by an integrative practitioner, and she was put on prescription antibiotics for not 1, not 2, but 3.5 years.
What?
Yeah.
What?
Yeah. Yeah. And
honestly, what are people doing? Good Lord.
So and part of why she ended up finding me, that integrative MD, at the time, I didn't look into it since then. This was probably 2-3 years ago. At the time, that integrative MD was being investigated and potentially losing her license. Well, gee, I wonder why.
Oh, God.
I mean, and I'm not like, I'm going to say, I'm not a Lyme disease denier. I actually had Lyme disease when I was 14. It was very bad. Like, I'm not a denier, and I'm not denying that some people really need antibiotics, and the stupid, 2-week course of doxycycline isn't going to cut the mustard for a lot of people. I'm not saying that longer term antibiotics are unuseful, but 3.5 goddamn years is insane.
Oh my God. That's wild.
The thing that boggles my mind too is this lady did not feel better at any point in this time period, but she was told, you have a really bad case. You have a really, really difficult, really persistent case. This is the worst case I've seen. And she was literally told by providers, I don't remember if it was the MD or somebody else, she was told that it was in her brain. And here's this woman who I think probably had some underlying anxiety tendencies to begin with. And then she's told that she has this really bad disease, and it's a really bad case of the really bad disease, and it's in her brain, and she's on long-term antibiotics, nuking the hell out of her microbiome. Well, when I got my hands on her, she was eating a grand total of maybe 10 foods, because she had convinced herself, she's like, I can't eat that because of histamine, I can't eat that because of oxalate, I can't eat that because of salicylates, I can't eat that because of this reason. She was on 10 foods. I think she had some IBS, shocker, because she was on antibiotics for so long. I remember, I don't know if you ever got a chance to do uBiome when it was around. It's another 16S test, but they had like a gut health marker that seemed like it. The Thrive stool test, literally 100% of my patients have had a good-looking gut health score on Thrive. And at some point a year or two ago, I just started telling people, ignore that. There's no way on God's green earth that all of my patients with IBS, SIBO, and IBD miraculously have great gut health scores. So I think they're full of shit. So I don't use the one from Thrive. uBiome had an interesting marker where they would kind of rank your diversity amongst the thousands of samples that they had seen. And this woman, her diversity was in the 2nd percentile.
Oh, no.
Compared to a bunch of people in probably the United States, Canada, UK, like in developed countries who already have bad diversity to begin with. So you really pardon me, you don't want to be at the bottom of the barrel of that particular barrel, first of all.
Right.
But she had the worst diversity marker I had seen on a Ubiome test at the time. And she had self-prescribed, or she had been prescribed, every herb on planet Earth that could theoretically maybe possibly help with Lyme disease.
Right.
And it was just like, and some of them were recommended by the integrative MD, some of them were self-prescribed via Google, but it was literally like, I looked at her list of like 40 different herbs and supplements, her whole regiment of stuff. And it was like somebody Googled herbs for Lyme disease and just put her on all of them.
Right.
And one of the first things I had her do was I had her discontinue 85% of those supplements, basically, and table those. And I had her start reintroducing some foods because I was reasonably sure she was not histamine intolerant. Spoiler, she was not. But we got her to a point where she actually got her diversity up a lot and she diversified her food. But I remember when she came in initially, she rated her anxiety as 10 out of 10. She rated her stress as 10 out of 10. And I remember, like, I like to think I'm a pretty chill, friendly person. And I'm very welcoming when you come into my office. She cried at least 3 or 4 times in our first appointment. And she was like, I'm sorry, like it's not you. I'm so, and she was so anxious. She was breaking down and crying multiple times at our appointment. And we got her to a point where, you know, then like maybe she cried once at our next appointment and maybe once at the next one. And then finally we got her to a point where she no longer was spontaneously crying at the appointments and she could start rating her anxiety as lower, and not to 0, but her anxiety started to calm down substantially. But I think a lot of it for her was her gut was just so decimated by the restricted diet, the outrageous number of herbs, and the outrageous number of antibiotics. And for her, getting her nutrition in line and getting her diversity up was probably the single most important factor in improving her anxiety. Again, it didn't go away. But again, she's still unfortunately working with at least one provider who keeps reiterating that the Lyme disease is in her brain. So it's, you know, it's tough trying to be the voice of reason with that sort of world. But anyway,
the last thing someone that's anxious wants to hear is there's Lyme in your brain.
I know. Well,
like it's hard for you to combat that too.
I'm not really clear. I forget what the guy does. I don't think it's Reiki, but I think it's something vaguely analogous. Like, he, like, puts his hands over her brain and over her skull, and he'll be like, ooh, I feel a lot of it right here. I'm going to clear it. And he'll, like, so it's some sort of energy.
Nikki, your eye.
I know, that was the clutch. But he'll do stuff like that where he's like hovering the hands over her skull and he'll be like, ooh, the Lyme disease is in your temporal lobe today.
Oh, God.
And he'll go get it. And
you're giving me real Yoda vibes.
Yeah. I don't know what to make of it. And again, like, I'm not denying nothing. I think I've had some people who swear by Reiki or energy work. I think that sometimes it can work. But I think there's also probably some charlatans out there who are making shit up. And the more I hear about this particular patient and this particular practitioner, I think he's making shit up. And it's like every time she goes in, he's saying, ooh, now it's in the such and such lobe. Or now it's in your cerebellum. And he'll like work on it for her. But then she doesn't feel notably better. I don't know. But anyway, so I think that's a piece of it. I think that's part of why her anxiety has never come down to a point where I think it could, because every week or whatever it might be, she's going to this person and he's doing his voodoo and telling her that, ooh, the Lyme disease is really a lot of it in the ponds today or whatever it might be. And it's like, how do you help that person who's been brainwashed to that degree? I don't know.
Well, and I will say too, I mean, we talked about this earlier, but, you know, I would say if you're leaving an office or an appointment with someone, I would say in general, you should feel pretty good. Like, at least that, like, when you're talking with someone, usually people feel good having a plan, like having
Yeah.
next steps. If your provider is making you feel extra anxious, or like you're
Or
feeling
defeated.
right
or
after each
unheard.
appointment, right, like again, it might be a clue to get a new provider if you're
Yeah.
if you know, appointments trigger more anxiety.
Yeah. I agree. And again, I think that's the case with her. But anyhow, I want to share that. But I'll also share there is a probiotic that has been shown to improve anxiety and depression. I don't remember the strains. I'm not very good at remembering the names of the strains typically, but I know that Jarrow sells it in the United States. So it's just their Jarrodophilus mood probiotic, but that particular combination has been shown to help with anxiety and depression both. There's like a multi-level marketing company that sells practically the exact same product, but for more money. I don't remember what it was called or what the company was, but somebody reached out and tried to get me to join, and I was like, no, why would I? Jarrow sells it for cheaper.
Right.
No thanks.
Right.
But I've had that be helpful for some patients, not everybody, but it can be helpful. My two favorite supplements for anxiety, my top two still would probably be CBD oil, preferably something that's full spectrum, and you might have to play with the dose and use a little bit of a higher dose. When I started playing with CBD oil for sleep purposes, I thought it did diddly squat for me. But then I realized that I was dosing it way too low. I was only taking like 5 or 10 milligrams. When I started taking it at a higher dose, like 50 or 60 milligrams, it does help with sleep for me.
Mm-hmm.
But CBD is pretty great for anxiety across the board. Like I have several patients who take it for either sleep or anxiety. And I think, honestly, the reason it helps with sleep is because it's anxiolytic.
Right.
Honestly,
right.
like I think that that's not coincidental. But I really like CBD. There's also a lavender oil gel cap product. There's two companies that make it. The one that I use most frequently is called Lavender SAP. I forget the name of the company now. Just Google it. But Lavender SAP, they're these little gel capsules, and that's been pretty well researched. Integrative Therapeutics makes one as well. It's practically the same, but it's like another $1 or $2 more expensive. And I think it might just be called lavender or lavender something. But those lavender gel caps can be really helpful for people with anxiety as well. And again, pretty well researched. I forget what the name of the formula is, but it's like a particular formulation. I have not had as good luck with like doTERRA, because I know like they put essential oils into capsules, and I just get real weirded out by that. I think that they're probably making them too potent for internal use.
Yeah.
So I don't like other brands, but Lavender SAP or the lavender product from Integrative Therapeutics can be really helpful. So those are probably my two biggest go-tos. And then the probiotic is kind of ancillary. There's other things that can be helpful for anxiety. I mean, glycine, any of the nervine herbs. So everything from lemon balm to St. John's wort, even herbs like kava kava can be really great for anxiety. It kind of just depends on like what your manifestation of anxiety looks like. Ashwagandha is anxiolytic, passion flower. So there's a lot of herbs that can help with anxiety, but it's just a matter of like tailoring it to the individual, because there's so many that could theoretically help with this symptom. But what are some of your favorite, kind of Band-Aids or supplements or herbs that can help with anxiety?
Yeah, I mean, I think since we've been doing this podcast and talking to people like Thomas, I think I've been definitely exploring a lot more nervine-based herbs with my clients and having good success with them. I have done the lavender, and it does help me. It knocks me out.
Oh, really?
Remember I was telling you I'm pretty sensitive to nervine.
Cheap date.
Yeah, I'm pretty sensitive. So, but sometimes I will do lavender if I'm feeling a little bit more.
You could do it as a tea. That might not be quite as much of a heavy hit if you do it as a tea.
That's true. But I do like the lavender with my clients. you gave me that hot tip in the past. And I think things like, again, adaptogens, like ashwagandha you had mentioned, I think can be beneficial. It's interesting you bring up CBD. Again, I have never done a true deep dive into CBD. Usually when my clients are like, oh, can I try CBD? I'm like, sure, it could be really helpful. But I've never really, used it extensively for anxiety or anything like that. But, I have seen it be helpful.
Expert in CBD.
Okay. Cool. But like, again, you probably have more experience than me. You've used it. But I will say I've had some clients like swear by CBD. They love CBD.
Yeah.
But yeah, those would be probably the main tools that I'd probably pull on. I'd really want to make sure too, like what you were saying, their nutrition's replete and that their lifestyle factors are in place. Alongside anything we're doing supplementally. Yeah.
And I think it's so funny. Like, again, I've played with some stuff for sleep purposes. So like the CBD and the lavender, for example. I learned about both of those primarily from firsthand experience, and then I started using them more.
Right.
I've played, like, and this might be a big ask, but like there's also like situational anxiety, which I have a little bit less to share on. So like for me, just for what it's worth, I have like pretty bona fide PTSD going to ear, nose, throat doctors because I had so many ear infections and so many ear surgeries as a kid and a teen. And it was just like such a prominent part of my childhood and my young adult life that now, even if I just go for like a simple checkup and they like scrape a little bit of shit out of my ears and take a look at my eardrum, I lose my damn mind.
Yeah.
And thankfully my ENT that I have now is like pretty integrative friendly.
Yeah.
Like he's still a pretty normal MD, but he's at least open-minded to the hippy-dippy stuff. So like I remember one time I put some diluted lavender oil like all over my chest before I went in, and you could smell it emanating off of me.
Right.
And I think he was just like, ooh. And I was like, yeah, sorry about the smell. I'm trying to calm the anxiety. He was like, oh, it's all right. My daughter loves essential oils. He didn't care. But like that didn't do it. I've tried taking high dose CBD. I've tried taking kava.
Right.
I keep playing with different things like before I go into an ENT appointment. And I haven't found anything yet that's really been like the holy grail for me.
Right.
I'm actually toying with the idea of doing hypnosis before my next one because really like I don't know. Because it's to a point where like sometimes I won't let the ear doctor finish what they're doing.
Right.
Like I freak out too bad I have to leave. And then I'm like, well, that was dumb. I paid for like half an appointment and he didn't even get to see my eardrum. And that's the whole point. I want them to visualize my eardrum to check on the hole. But yeah, I think I might even try hypnosis. I don't have experience with it yet, but I'll have to. My next ENT appointment is in November, I think. So I have a little bit of time to debate and work on this. But yeah, I might have to reprogram the brain. Yeah, I might have to think about reprogramming the old hard drive here.
Yep.
Yeah. I will also say one other tool to consider. If you have not yet discovered the holistic psychologist on Instagram, what rock do you live under? Oh my goodness. She's fantastic. Lots of little nuggets. She has a book. She has a podcast. She has a course. So much information from that woman, but there's a lot of good information from her. We talked about Dr. Franklin's website, Don't Hate Your Guts, and she has a YouTube channel as well under the same title, Don't Hate Your Guts. And there's a YouTube channel called Therapy in a Nutshell that I really like. And she has several series about anxiety and panic and working through different elements of anxiety. So those three resources, if you guys are not familiar, holistic psychologist, primarily she's on Instagram, but she also has other resources. Therapy in a Nutshell on YouTube and Don't Hate Your Guts on YouTube are 3 really fantastic resources to kind of help you understand and develop that toolbox so that you are not victim to your anxiety and it's not running the show as much as it maybe is right now.
Yeah. I like the holistic psychologist. I follow her.
Yeah. She's legit. Although, you want to know something kind of funny, by the way?
Sure.
So her name is Nicole.
Mm-hmm.
And my name is Nicole. I usually go by Nikki, but my legal name is Nicole. And all of like my professional stuff is usually under Nicole. So like if you look up like my website,
Right.
it says Nicole generally. Because that's like the name my license is under. It
Right.
seems like the thing to do. So I am on the Holistic Psychologist's email newsletter, but the way she addresses it, it comes from Dr. Nicole. And I think I have to unsubscribe, honestly, because every single time I see an email from her, I panic a little bit because I think, oh shit, did my VA send out an email that I wasn't aware of?
Oh my gosh.
What does it say? And I panic because I look at the title and I'm like, I don't remember writing that email. And then I panic for a second because I'm like, oh, because like my Facebook ads manager has access to that account and my virtual assistant has access to that email account. And I'm like, oh God, did they hit send on an email that I didn't approve of? And I panic every time. So I really wish she wouldn't call herself Dr. Nicole because it's deeply confusing for other Nicoles to get an email
Other
and
Dr.
immediately
Nicoles.
freak out and think it's, yes. And I freak out every time. So honestly, I think I have to unsubscribe from her email list. I can't handle it anymore. Ugh. But, if you're not a doctor and you're not named Nicole, I highly recommend following her email newsletter.
Oh, yes.
Because it won't cause anxiety for you. Oh, never a dull moment. Well, my dear, I think that's a wrap. Do you have any additional words of wisdom, or shall we call that
I think we should
a day?
call it a day.
All right. Well, guys, you know the drill, but I'm going to say it anyway. If you are on the YouTubes right now, if you could click like, comment down below, subscribe to our channel. Yes, those things actually do really help us. It helps us grow the channel and tell YouTube that you want to see more of this content. If you are on iTunes, if you could rate us 5 stars, similarly, that does help us, believe it or not. And if you feel so inclined, you can share this with God in the world, whoever you think might need it. But we're trying to provide a lot of value here, so whatever you could do to spread the word, we would be deeply appreciative. And as always, we will see you in the next episode of the IBS Freedom Podcast. Take care, guys.